Welcome to NHCGNE's third award ceremony for our distinguished educators of gerontological nursing. I am Jan Mentes, president of NHCGNE. We are excited to recognize 56 distinguished educators this year. These individuals have demonstrated expertise in gerontological and geriatric nursing education and have proven track records in creatively working with students, faculty, and older adults in diverse settings. This exclusive recognition is based on a rigorous application process that documents evidence of excellence in gerontological nursing education. With the recognition of this cohort, we now have a cadre of 148 distinguished educators in gerontological nursing. NHCGNE congratulates each of you, and we applaud the important work that you do.
Kayla Blakely of University of Alabama at Birmingham School of Nursing responds to the question, what motivated you to become a gerontological nurse educator? After 5 years of caring for mainly geriatric patients in a rural setting, I recognized more providers were needed to care for this population. Disseminating knowledge about primary care for geriatric patients and improving quality of care is my passion. This inspired me to seek a faculty appointment at the University of Alabama at Birmingham School of Nursing in 2014. It is my passion to educate the next generation of NPs to be competent healthcare providers. Along the way, I have had excellent clinical and faculty mentors that have encouraged me to pursue my passion and drive to improve healthcare and access to quality care for the rural geriatric population. Thomas Blodgett of Duke University School of Nursing responds to the question, what are your words of wisdom for those nurses interested in becoming a distinguished educator in gerontological nursing education? Thomas responds, we still have so much work to do as gerontological nurse educators. While much progress has been made over the past 15 years, clinical nurses in virtually all roles and scopes of practice remain disengaged with the unique healthcare needs of older adults. Nurse educators with an interest in gerontological nursing should actively work to turn this interest into their professional calling. Seek out continuing education programs in gerontological nursing, expand your credentials through postgraduate certification programs in adult gerontological advanced practice nursing, or complete a doctorate/postdoctoral program in gerontological nursing science. Consider tailoring your graduate capstone project or thesis towards a topic related to the older adult population. Perhaps most importantly, get involved with at least one nursing or interprofessional organization that focuses on gerontology or geriatrics. This is where you can learn about conferences, in parentheses, go at least once every few years, continuing education offerings, and networking opportunities. Your passion will only grow from there. Mei Lan Chun of Georgia State University, Burdine F. Lewis College of Nursing and Health Professions responds to the question, what motivated you to become a gerontological nurse educator? She says, I have always enjoyed working with older adults. My love and passion for the older adult population motivated me to become a gerontological nurse educator. As a gerontological nurse educator, I have the privilege to prepare and foster the next generation of nurses with knowledge, skills, and competence to advance the quality of care, nursing science, and health policy for diverse older adult populations. Shamika LaRonda Cody of University of Alabama Capstone College of Nursing responds to the question, what are your words of wisdom for those nurses interested in becoming a distinguished educator in gerontological nursing education? She responds, I have so much respect and admiration for a generation who have dedicated so much of their lives to the world. It is important to educate students to assess for atypical symptoms and nonverbal cues, investigate beyond the chief complaint, and be a listening ear and voice for older adults. I am thankful for the older adult population and their willingness to share memories, lived experiences, and wisdom with me. Their life experiences and hardships shape who they are, their perceptions, and healthcare beliefs. Geriatric educators should encourage older adults to teach us who they are, and in turn, we can provide optimal care for the quote-unquote whole person and prepare students to care for this unique population. Anne-Marie Dowling Castronova of Wagner College, Evelyn L. Spiro School of Nursing, responds to the question, what is your favorite experience as a gerontological nurse expert educator? An undergraduate nursing student assessed that a patient was confused, quote unquote, a word that make a gerontological nurse expert shudder. I went beside with the student and demonstrated a comprehensive mental status exam while using therapeutic communication techniques. My assessment revealed a much different clinical picture. The patient was not confused, but instead was fed up with being a hospitalized patient who was processing through a newly diagnosed cancer diagnosis. There were many aha moments in that clinical encounter. My favorite experiences typically are clinical ones. However, I do love introducing Banana George to students as one way to combat ageism. Rowena Elowit of Emory University Neil Hodgson Woodruff School of Nursing responds to the question, what is your favorite experience as a gerontological nurse expert educator? My favorite experience as a gerontological nurse expert educator was when my nursing students had to prepare creative audiovisual public service announcements as teaching tools for older adults. I wasn't sure how serious they would take this assignment. However, I was pleasantly surprised. I was extremely impressed by the students' efforts to incorporate creativity and adult learning principles throughout the project. Their projects were created with excellence and were impeccable. The one thing that stands out most about this experience is when the students voiced a greater appreciation and respect for older adults through completing this assignment. Donna Fick of Pennsylvania State University College of Nursing responds to the question, what is your favorite experience as a gerontological nurse expert educator? What I am doing right now is my favorite teaching in the Age-Friendly Healthcare System Initiative with IHI and the Penn State GWAP Age-Friendly Pennsylvania, as I feel like it has the ability to make broader practice change, and I love the quality improvement process led by the Institute for Healthcare Improvement. I also love the one-on-one experiences I had as an ANCC certified geriatric CNS at Yale New Haven Hospital in the 1990s. I felt like I was able to impact change in one nurse with education and mentoring, and then see the light go off and see their passion emerge. Years later, I have had several of these nurses email me about their career and life, and they go on to improve care or advance the science of care in practice and or research and impact others that they teach. Nikki Lynn Hill of Penn State University College of Nursing responds to the question, who is a key person who supported you in becoming a gerontological nurse educator? How can I just pick one, she says. Ann Kolonowski and Donna Fick both inspired me to become a gerontological nurse educator. Marie Boltz has guided me to continue in my own professional development, and all of my NHCGNE College motivate me to grow as an educator and as a scientist. Ann Horgas of University of Florida College of Nursing responds to the question, who is a key person who supported you in becoming a gerontological nurse educator? Ann responds, I have had many positive influences. One of my first influences in gerontological nursing was Dr. Lori Gunter at Penn State University. She was among the first gerontological nurse leaders in the United States and was very influential in shaping my thinking about gerontological nursing. Over my career, I have been supported by family, friends, colleagues, and students, all of whom support my work, challenge my thinking, and foster ideas for improving the care of older adults. Deborah Hummer of University of North Carolina at Pembroke Department of Nursing responds to the question, what are your words of wisdom for those nurses interested in becoming a distinguished educator in gerontological nursing education? Pursue your dreams, she says. As our nation's population ages, we are in need of nurses in all healthcare settings to receive specialized education in care of the older adult. To achieve this goal, we need more distinguished educators in gerontological nursing education. Rita Jablonski of the University of Alabama at Birmingham School of Nursing responds to the question, what motivated you to become a gerontological nurse educator? I was part of the inaugural pre-doctoral class of the Building Academic Geriatric Nursing program, which evolved into the NHCGNE. As part of this very important program, I saw that leadership incorporated more than being an expert researcher. It was very important to also develop one's skills as a gerontological nurse educator in order to disseminate optimal practices that improve the care of older adults. Melissa Jones of DEGN University School of Nursing says in response to, what are your words of wisdom for those nurses interested in becoming a distinguished educator in gerontological nursing education? She responds, aging is a personalized experience, and as a distinguished gerontological educator, we have the ability to be recognized for our educational efforts to promote the best aging experience possible. Jeanette Cates of Thomas Jefferson University College of Nursing responds to the question, who is a key person who supported you in becoming a gerontological nurse educator? Jeanette credits her mentor, Dr. Neville Strump, with her development as a gerontological nurse educator. It was Dr. Strump who ignited my passion for older adults as an undergraduate and graduate nursing student at the University of Pennsylvania, and it is her legacy that continues to inspire me today. Erin Lamoureux of University of Massachusetts Amherst College of Nursing responds to her favorite experience as a gerontological nurse expert educator by saying, my favorite experience as a gerontological educator is related to an assignment in the global aging class. Each student in the class completed an interview with an older adult in the community. I was able to find older adults in the surrounding communities that the students could interview. I was so happy to hear the stories that the students told me about the older adults. Many students were very surprised on how active the seniors living in the community were. I think this helped to demystify that myth that many students had, which was, quote unquote, most older people are dependent on others. Anna Marshallek of Mercy Home Health and Mercy Life responds to the question, what is your favorite experience as a gerontological nurse expert educator? She says, during the COVID-19 pandemic, I had been deeply involved in providing education to staff and older adults on understanding the coronavirus and how to stay safe and healthy during this very challenging time. Developing and providing that education has been an amazing opportunity, but I really do not have one favorite experience. My entire career has been a labor of love. Every single time I contribute to increasing someone's knowledge and skills in the care of older adults is powerful and rewarding. I know they will carry that forward, and the impact of that knowledge will be like a stone in a pond, rippling through other caregivers for generations to come. My current role as the Senior Director of Education for Trinity Health PACE, a PACE program of all-inclusive care of the elderly, and Trinity Health at Home enables me to influence clinical standards, evidence-based practice, and quality of care across community-based practice settings across the country. So once again, my current practice validates that every day for me is my quote-unquote favorite experience. Graham McDougall Jr. of Florida State University College of Nursing responds to the question, what motivated you to become a gerontological nurse educator? He says, my grandparents were integral in my growth and development. I could not imagine a life without these individuals who offered unconditional love and acceptance. They provided unique experiences above and beyond what my parents were able to offer with their responsibilities. They were my inspiration. During my master's program at LSU Health Sciences, my professor, Dr. Merville Bracewell, secured NIMH funding for fellowships in geriatric mental health nursing. This NIMH scholarship was precedent and led to my future career in cognitive aging. Anne Bradley Mitchell of Thomas Jefferson University College of Nursing responds to the question, what are your words of wisdom for those nurses interested in becoming a distinguished educator in gerontological nursing education? Anne says, the often used phrase, see something, say something, should be your hallmark. Nurses envision the complete picture, yet can focus on the relevant issues. Distinguished gerontological educators provide the voice for the older adult and their families, educating not just the older adult and families, but other healthcare providers, community members, and policymakers. Distinguished nurse educators are the advocates to improve the well-being for all older adults in the community and along the continuum of extended care. Seek out opportunities to shine as a gerontological nurse educator. In particular, think of all those who need to be educated in professions outside of healthcare. Jeanette Pettis of NYU Rory Myers College of Nursing responds to the question, what are your words of wisdom for those nurses interested in becoming a distinguished educator in gerontological nursing education? My words of wisdom for all nurses, including those who wish to become a distinguished educator in gerontological nursing education, focus on two things: mentoring and involvement in professional organizations. I believe that, regardless of the stage of their career, nurses can benefit from the wise counsel of mentors. I am blessed to have the support and care of some wonderful nurse mentors, and I am so grateful to them for how they have helped to shape my personal and professional life. One potential means to identify mentors is through involvement in professional organizations. However, these organizations offer so much more. They offer the opportunity for service to the profession, scholarly collaboration and dissemination, networking, and much more. It is important for the aspiring distinguished educator in gerontological nursing educators to explore various professional organizations and join those that best meet their needs and interests, and then they may engage in and contribute to them. Lena Sargent of Virginia Commonwealth University College of Nursing talks about her passion. With a passion for biophysical optimization in the older adult, it is a privilege to teach graduate students about the complex care needs of older adults, geropharmacology, and diagnosis and treatment of chronic diseases. My approach to teaching is based on my scholarly research interests in active and technology-enabled learning and simulation that reinforces context-based nursing.
Sarah Endicott, University of Wisconsin-Madison School of Nursing. When asked, what are your words of wisdom for those nurses interested in becoming a distinguished educator in gerontological nursing? Sarah replied, whenever I speak to our first-year nursing students, I ask them how many hope to work with older adults in their nursing career. Usually only 3 or 4 students out of 150 will raise their hands. I hope those numbers change as students move through our programs. Regardless, we face a big challenge in nursing education to move the needle when it comes to increasing the number of nurses who see gerontological nursing as a first choice, as a desirable profession. My advice for educators who love gerontology, who have deep career satisfaction in working with older adults or studying aging, is to share that passion, not just with students, but with friends, family members, colleagues, community leaders, and the media. While I have the benefit of seeing attitudes and preconceived notions about aging change over the course of a single lesson in the classroom, I hope to see the impact I can have in the community on policymakers and healthcare system leaders in the future. I love that I can impact a single student or the patient in front of me, but I aspire to positively impact the care for older adults in our healthcare system. Nilafar Hadidi, University of Minnesota School of Nursing. When asked who is a key person who supported you in becoming a gerontological nurse educator, Nilafar replied, "My mentors have been critical in supporting me in this journey. My postdoctoral mentors, Dr. Ruth Lindquist from the University of Minnesota and Dr. Kathleen Buckwalter from the University of Iowa, were truly my key mentors in providing guidance and opportunities for furthering my skills in this area, as well as encouraging me to pursue my dreams." Barbara King, University of Wisconsin-Madison School of Nursing. When asked, who is a key person who supported you in becoming a gerontological nurse educator, Barbara replied, "The key person that sparked my passion for geriatrics and gerontology has been my long-term mentor and friend, Dr. Barbara Bowers from the University of Wisconsin-Madison School of Nursing. Dr. Bowers has and continues to help me push the boundaries of what I think is possible in gerontological nursing education. She has provided me with numerous leadership opportunities in my School of Nursing and beyond, introduced me to thought leaders in gerontological nursing both nationally and internationally, and supported recognition of my expertise locally, regionally, and nationally." Helen Locke, St. Louis University. When asked who was a key person who supported you in becoming a gerontological nurse educator, Helen responded, "Dr. Patricia DeMuth, who recently passed away, started a clinical nurse specialist program in gerontological nursing at St. Louis University in the 1980s. She brought students to my floor in the hospital and we talked about gero nursing, and she knew I was interested. She led me to the program where I became a specialist. Beyond that, I have had so many mentors, including a plethora of gerontological nurses, but also physicians, social workers, therapists, and many others on the interprofessional team." Todd Monroe, The Ohio State University. When asked what motivated you to become a gerontological nurse educator, Todd replied, "While practicing as an ICU nurse, my grandmother was diagnosed with Alzheimer's disease, and then as her Alzheimer's disease progressed, she was diagnosed with breast cancer. I recognized the great difficulty the staff and our family had in making decisions about her care and determining when she was in pain. As a family, we experienced much prolonged grieving and even found it very difficult to initiate hospice services. This experience, along with outstanding mentorship, established my passion for gerontological nursing research and education. Seminal mentors have included Keela Hare, Michael Carter, Lorraine Mion, Cornelia Beck, Claudia Beverly, John Gore, Ronald Cohen, and Roger Fillingham." Janice Palmer, University of Missouri, St. Louis. When asked what motivated you to become a gerontological nurse educator, Janice replied, When I returned to school, I had no intention of leaving my work as a research instructor at an Alzheimer's disease research center. However, I was motivated to move into a full-time nurse educator role because of the need. The statistics on the shortage of nursing faculty are staggering. These statistics, coupled with the graying of our population, were too significant to ignore. Amanda Peacock, Loyola University, Chicago, Marcella Niehoff School of Nursing. When asked, what motivated you to become a gerontological nurse educator? Amanda replied, I want to promote geriatric nursing at the RN and advanced practice level. There is a need for nurses with geriatric expertise, just as there's a need for cardiology expertise or neurology expertise or any other area. I wanted to be a part of a group of people who are equally dedicated to advocating for geriatric nursing. I wanted to join other educators who are actively pursuing ways to teach geriatrics in the most innovative ways. Karen Rose, The Ohio State University. When asked, who is a key person who supported you in becoming a gerontological nurse educator? Karen replied, Meridine Moss and Kathleen Buckwalter. Their role modeling of the importance and significance of being a gerontological nurse educator really served as the impetus for my love of this field and for my passion to teach others in this area. Kathy Wright, The Ohio State University. When asked, what is your favorite experience as a gerontological nurse expert educator? Kathy replied, teaching acute care nurses about the dysfunctional syndrome and seeing them develop ways to prevent deconditioning in the acute care setting. In addition, I enjoy watching the light bulb go on for my students, getting the aha moment of the role of the gerontological nurse.
Joanne Alderdine, University of Utah, College of Nursing. Joanne, or as we know her as Jenny, shares a little something of her life. She's worked as a military nurse where she was appointed lead nurse for shock trauma platoon in Al-Anbar, Iraq. She also served as a fixed wing and rotary ring en route care nurse. Dr. Alderdine studied hospital-acquired pressure injuries among critical care patients in her dissertation work and subsequently received the University of Utah College of Nursing's Outstanding PhD Student and Outstanding Dissertation Awards, as well as the Sigma Theta Tau International Honor Society of Nursing Research Dissertation Award. Heather Carlisle, the University of Arizona College of Nursing. When asked, what are your words of wisdom for those nurses interested in becoming a distinguished educator in gerontological nursing education, she responds, teaching is the greatest act of optimism. Quotes Colleen Willocks, noted superintendent of schools. I envision the day when we care for our older adult population the way we would want our children to be cared for in their old age. I am optimistic that by inspiring nurses to embrace working with older adults, rather than shying away from them, we can greatly improve healthcare for future aging populations. Inspiring nurses to specialize in gerontological nursing requires those of us who are passionate about this specialty to impart that enthusiasm and knowledge to nurses, whether formally in the classroom or by mentoring new nurses at the bedside. Helen Farrar, University of Oklahoma Health Sciences Center, Fran and Earl Ziegler College of Nursing. When asked who is a key person who supported you in becoming a gerontological nurse educator, she answers, The administrative staff and faculty of the D.W. Reynolds Center of Geriatric Nursing Excellence at the University of Oklahoma, Fran and Earl Ziegler College of Nursing were key supporters of my role as a gerontological nurse educator. They encouraged and supported me throughout my doctoral program and transitioned into the faculty role. Every idea I have had on how to bring geriatric issues to the forefront, they've been supportive of. Even when it wasn't strictly part of my job, they recognized it was part of my passion for this population. Michelle Kimsey, Texas Christian University College of Nursing and Health Sciences. When asked, what are your words of wisdom for nurses interested in becoming a distinguished educator in gerontological nursing education, she answers, gerontological nursing educators are leaders in many sectors, and opportunities are endless for nurse educators. We will continue to play a pivotal role in education and research. I believe gerontological nursing education is rewarding because of what you gain from the older adults. Their stories and experiences are a priceless gift. Cheryl Krusky, Regis University, Maven Healthcare Consulting. When asked, what are your words of wisdom for those nurses interested in becoming a distinguished educator in gerontological nursing education, she answers, as the population of the world continues to age, as understanding the aging population, how to care for them becomes even more important. Becoming a gerontological nurse educator is important to the growth of future nurses who will work with the aging population across the healthcare continuum. Our aging population deserve well-educated nurses who have the knowledge, skills, and abilities necessary to provide evidence-based care to this population. Cheryl Lacasis, the University of Arizona College of Nursing. When asked what motivated you to become a gerontological nurse educator, my passion for gerontological nursing was nurtured by gerontology and oncology nurses, educators, and researchers throughout my career and my early experiences with 4 grandparents who all aged with joy, curiosity, grace, and full engagement in life. Working with older adult cancer survivors in acute care and outpatient settings, I learned that this population has unique care needs that needed to be recognized by their care providers. As a gerontological nurse educator, I am motivated to inspire novice nurses to appreciate the unique and rewarding dimensions of caring for older adults. Allison Lindauer, Oregon Health and Science University, Latent Aging and Alzheimer's Disease Center. What are your words of wisdom for those nurses interested in becoming a distinguished educator in gerontological nursing education? Allison answers, I think of the later life as a new chapter for growth and development, not as a period of winding down. As educators, we need to help students appreciate this spectrum of growth. Elizabeth Long, Lamar University, Dishman School of Nursing. When asked the question, what motivated you to become a gerontological nurse educator, she answers, as a nurse and nurse practitioner, I've been fortunate to work in a variety of healthcare settings, including intensive care, home health, hospice, a physician office, long-term care, and education. Regardless of the work setting, assignments with older adults proved to consistently be where I was drawn, specifically to persons with dementia. The field of gerontology, and particularly caring for a person with dementia, can be challenging or intimidating for nursing students and even our peers who do not routinely work with this population. As a gerontological nurse educator, I have the opportunity to guide future nurses and nurse peers to become a difference at the bedside by bridging gaps in attitude, knowledge, and applications of evidence-based practice in the care of older adults and persons with dementia. This in turn promotes improved outcomes and experiences for a larger number of older adults. Mila Magno, Michael E. DeBakey, VA Medical Center. When asked what is your favorite experience as a gerontological nurse expert educator, she answers, my favorite experience as a gerontological nurse expert educator is working, teaching, and learning from novice to expert interdisciplinary team of physicians, nurses, pharmacists, or nutritionalists. The knowledge, skills, and exchange of ideas, while challenging, fosters stimulating professional growth and development. It appears there's always something new to learn and share with our colleagues and students in our practice every day. Susan McLennan, University of Nevada, Las Vegas School of Nursing. When asked what motivated you to become a gerontological nurse educator, she answers, my early experiences as a nurse in the ICU in Florida is where my interest in gerontological nursing began. Florida has a large percentage of older adults in the general population, many of whom ended up in intensive care for long periods of time as they experienced health challenges. I found myself frequently engaging in end-of-life conversations with family members and the patient's physicians trying to mediate optimal outcomes that were congruent with the patient and family's wishes. These experiences convinced me there was and is a need for nurse education about end-of-life conversations and the nurse's role. Mary Ellen Ross, the University of Texas Health Science Center at Houston, UT Health, Cizik School of Nursing. When asked, what is your favorite experience as a gerontological nurse expert educator, she answers, a majority of students who enroll in my gerontological nursing courses are initially disinterested in care of older adults. Taking advantage of every opportunity to engage students in learning through various teaching, learning activities, it is very rewarding to see positive attitudes, behaviors, and skills develop during the course of the semester. Many students find that they desire to care for the older adult population after graduation.
Angela Casey, La Trobe University School of Nursing. In response to the question, who is a key person who supported you in becoming a gerontological nurse educator, Angela responds that she's been fortunate to work with many wonderful nurses in aged care. I have so much admiration for many colleagues. The aged care nurse who stands out most was Sally Garrett from La Trobe University. I was so lucky to have Sally as both a manager and an educator during my career. Her passion for improving the care delivered to older people and the knowledge of nurses rubbed off on me. I'm feeling very sad as unfortunately Sally died in 2019 and I can't share the news of this award with her. Daphne Z. Ki Chung, the Hong Kong Polytechnic University. In response to the question about what motivated her to become a gerontological nurse educator, Daphne responds that we all get old. The elderly deserve our care and respect. When I get old, I expect people to treat me with respect too. Being a gerontological nurse educator, I can influence generations of healthcare or nursing students to give care, show respect, and improve quality of life of the elderly. My life and strength are limited, but I hope that through education, the values of care and respect of the elderly can pass on over generations. Pearl Cuevas, Centro Escolar University School of Nursing. In response to the question about her words of wisdom for nurses interested in becoming a distinguished educator in gerontological nursing, Pearl responds, "To care for those who have once cared for us is the greatest honor. Caring for older adults help enrich our lives through the sharing of experiences and introspection into their own lives. These moments of caring usher nurses interested in gerontological nursing to the self-awareness that they have chosen the right field or specialization to serve. My vision for the future of gerontology nursing is to have better opportunities for nurses to practice the care of older adults in various settings. Furthermore, to embed gerontology nursing in the curriculum from the standpoint that aging is a life course perspective." Yi Shui Bernice Law, Chinese University of Hong Kong, Nethersole School of Nursing. In response to the question about your words of wisdom for nurses interested in becoming a distinguished educator in gerontological nursing, Bernice responds, "Empathy. Put yourself in their shoes to understand their unique needs. It's a challenging process, but you will find it fruitful and rewarding." Megan Liu, Taipei Medical University College of Nursing. In response to the question, who is a key person who supported you to become a gerontological nurse educator, Megan responds that she was raised by her grandparents and spent most of her summer time at her grandparents' place. When aging and age society issues were not so evident, my grandparents supported me both physically and psychologically to pursue gerontological nursing in both a master's and PhD programs. My grandparents had the vision to foresee and embrace the unknown and to encourage me to pursue what I wanted. Margaret McAndrew, Queensland University of Technology School of Nursing. In response to the question, what motivated you to become a gerontological nurse educator, Margaret responds that her motivation for becoming an educator came from her time working in residential aged care. While I was always in awe of the level of commitment aged care nurses had to providing quality care, lack of knowledge of best practice often prevented this from occurring. It was while working in aged care that I started postgraduate study for myself to improve my own knowledge deficit. It was during this study that I realized how complex the care of older person is and how little I was taught about this in my general nursing training. This inspired me to try to make a difference to the quality of care for older people through improved knowledge of nurses. Christina Parker, Queensland University of Technology School of Nursing. In response to the question about her favorite experience as a gerontological nurse expert educator, Christina responds, "I very much enjoy educating students using my own experiences. This brings a real-life focus to what I do and makes the teaching informative and interactive. I enjoy taking an interprofessional approach to educating, where when unit coordinating my wound care unit in the School of Nursing, I also invite students from podiatry, pharmacy, and exercise and nutrition sciences to come to our lectures, tutorials, and clinical laboratories. Teaching in this unit culminates in all students being involved in small groups and academics acting as a person with a wound that the students then have to develop a plan of care for. These wounds are venous leg ulcers, pressure injuries, and skin tears that are more prevalent in our older population. The students work together in an interdisciplinary group and learn with and from each other. Academic feedback is what they enjoy being part of this interactive activity, and student feedback indicates that an increased awareness of other disciplines and the need for interdisciplinary involvement when caring for older people with wounds. QUT is one of the only nursing courses in Australia with a dedicated wound care unit for undergraduate nursing students. Wanicha Pangchumpu from Chiang Mai University Faculty of Nursing. In response to the question, what motivated you to become a gerontological nurse educator, Wanicha responds, we are now living in an aging society. The increase of the aging population in Thailand and around the world reminds me that gerontological nurses have a big responsibility within the healthcare system and our society. It is our duty to improve the quality of care and enhance the life and society of older persons and their families. Gerontological nurse educators specifically are important to create knowledge, conduct research, and develop innovations for the sustainability of healthy aging and maintaining the good health and well-being of an older population. Linda Schnitker, Queensland University of Technology School of Nursing. When asked about who was a key person who supported her in becoming a gerontological nurse educator, Linda responds, it's Dr. van der Sand, who is specialized in gerontology and geriatrics. That is my key person in becoming a gerontological nurse educator. Dr. van der Sand taught me the key principles to care and treat older people within a multidisciplinary approach, ensuring the older person's physical, mental, and social aspects were met. Seung Hee Tak, Seoul National University College of Nursing. In response to the question, what is your favorite experience as a gerontological nurse expert educator? Seung Hee responds that it includes the development of 2 new graduate level courses, one in technology and aging care and one in tailored nursing intervention research. The first course is to provide an overview of technologies that have the potential to be applied in caring for the aged. Students are expected to critique selected technologies in terms of effectiveness, appropriateness, and usability in improving the health of older adults. Tailored nursing intervention research for graduate nursing students focuses on understanding person-centered care and developing tailored nursing interventions that are appropriate for critical individual characteristics such as cognitive impairment, functional limitation, old age, gender, and ethnicity. Jonah Yao, Cebu Normal University College of Nursing. In response to the question, what motivated you to become a gerontological nurse educator? Johnny responds that even before he became a nurse, he always wanted to help older people, especially those who are homeless and being neglected. I told myself that if I can help them in whatever way, I would do it if I have the capabilities and resources. When I became a nurse, an important part of my journey of becoming a gerontological nurse educator started when I took my doctorate degree in gerontology nursing. While taking up different courses for the degree, aside from the various concepts in gerontology that I learned, I was inspired by the various experiences and insights of my professors who are experts in their respective fields in gerontology.
Hi, everyone. This is Ellarine Sanders, and we want to thank Penn State College of Nursing for sponsoring the DEGN Award session for 2020 in honor of their new DEGNs, Donna Fick and Nikki Hill. We want to congratulate each of those who have been recognized this year. We would love to be able to toast you with something sparkling and bubbly in person. Since that's not possible, we will raise a virtual toast for all of you. We hope that you can celebrate with those who are near and dear to you. We invite you to be involved with NHCGNE through the Distinguished Educator in Gerontological Nursing Special Interest Group that was established in 2020. The special interest group will be meeting during the conference, so please join the group later tonight at 8:05 p.m. Eastern Time. We will share the meeting schedule with you for 2021. Again, congratulations to each of you, and again, a huge thank you to Penn State College of Nursing for sponsoring this event. Have a great evening or morning, as the case may be. I hope that you're enjoying our virtual conference. Please join us for the next live session where Neville Strump, our Mary Stark Harper Excellence in Nursing Award recipient for this year, will provide an interesting dialogue facilitated by Ann Kolanowski. Thank you.